I'm Dr Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video edition on how to avoid pterygia. Well, it's a bit of a tautology. If you've got pterygia, you can't avoid them. You've got them, they're there. But really what it's about is how do you minimise the progression and how do you minimise getting it in the first place. Firstly, to differentiate, there's little white, yellow dots on the inside of the eye. They're not pterygium, they're called pinguicula. They're degenerative change. Sunlight will induce degenerative change in the body because UV causes it. Just look at your car paint, look at the rubber on your tyres. Things degrade over time because of UV light. Get used to it. We're all part of this system we live in. But when you do get excessive UV, it's one very important trigger for pterygium, where that little fleshy bit starts to grow into the eye. Now, the people at most at risk are people, believe it or not, who actually have good vision, because the front of the eye acts as a lens, and that lens focuses light into the corner, 20 times the ambient light. And the light that it focuses comes from the side or behind you. So if you really want to prevent pterygia, you must get very big wraparound studies that cover the whole side. There's no point in little John Lennon sunglasses up front. They're not going to do a damn thing for you. You've got to control that light coming from the side. And really the light is everywhere. You can sit in an office by a window. That'll filter out UVB but not UVA. So if you sit there by the window, it doesn't matter you've got glass there, that light's coming through and it's going to hit you. If you're in a truck and you're driving and you've got the sun inside, this right eye is going to be more problematic than the other. So really, to prevent progression of disease, you need to control UV light. Now, if there's inflammation, then to settle it down, you need some anti-inflammatory drops, which should be prescribed. They're usually steroid drops. But they're the two greatest ways to stop progression of disease or stop developing or prevent the development of pterygium in the first place. In Australia, we have excessive amounts of UV. You cannot see it. If you could, it would be like walking through black, thick fog. You wouldn't know where to go. But you can't see it, so you forget about it. However, it is there, and it is extremely prevalent and extremely intense. I hope that all makes sense. I'm Dr Anthony Maloof from Eyes and Faces and Corneal Oculoplastic Surgery in Sydney. Thanks for watching.